Hello everyone, my name is Amanda Burt, and today I will be discussing my community plan and project for the city of Milwaukee. This project will include an overview of community health of the Milwaukee community, a community assessment and data, an overview of community partnerships and resources used for this project, a community health diagnosis, a community health plan, interventions and implementations, and goals for the community health project. So, what is a community? A community is defined as the people living in one particular area or people who are considered as a unit because of their common interests, social group, or nationality. Communities can be found in rural areas as well as cities, all unique and diverse in what they offer and their culture. Each community has unique opportunities and experiences for its residents as well as visitors, whether it's jobs, entertainment, family resources. Many individuals find themselves moving to new communities to seek new opportunities, while others move out of their current community due to the limitations and lack of resources. Ultimately, communities each present their own strengths and opportunities, as well as limitations and setbacks. This community project focuses on the Milwaukee community. Milwaukee is the most populated city in the state of Wisconsin, nearing 600,000 residents. The city has 3 rivers running and intersecting through it and lies along the coast of Lake Michigan in the southeastern area of the state. The city is diverse, with the majority of the population being African American and Hispanic. Unfortunately, Milwaukee does face many health disparities, which are largely associated with its neighborhoods of differing socioeconomic status. These health disparities are particularly seen in West wealthy neighborhoods and among minority groups. Overall, these health disparities contribute to the city having relatively poor health. Overwhelmingly, prominently faces health issues with obesity, mental illness, heart disease, and substance abuse. Addressing these health issues in the city of Milwaukee requires a collective effort of the city with health facilities and providers producing resources and supporting the community. The Windshield Survey provides an overall view of the Milwaukee community and is beneficial in identifying areas where the community has needs that need to be met. Milwaukee has many neighborhoods that vary in wealth as well as segregation. Many health issues and community needs are much more visible and prevalent in poor segregated neighborhoods. The neighborhoods that lie on the outskirts of the downtown area of the city are more run down. These neighborhoods are of lower quality overall, include more individuals of minority economic status, contain a larger homeless population, and present with high rates of health issues contributing to the overall health of the city. These neighborhoods are examples of the areas in the Milwaukee community that need education and additional resources available to improve their overall health. Status neighborhoods are incredibly segregated, with many low-income families being African American and Hispanic. Further, segregated neighborhoods show an increase in incidence of mental health conditions and obesity. Overall, socioeconomic status factors such as education and income are predictive of health outcomes in Milwaukee, as well as the neighborhood effects that are associated with poverty. These disproportionate socioeconomic status representations in the Milwaukee community neighborhoods lead to disproportionate health issues among individual groups in the community. This obesity and heart disease both being high among African Americans, as well as mental health being a comorbidity to obesity and heart disease. It is important to address obesity and treat it as a primary cause. By addressing and treating factors that contribute to obesity on the obesity health issue, as well as mental health issues in the Milwaukee community. A community assessment provides detailed analysis of the areas that are in need in the Milwaukee community. The population nearly 600,000 people, a diverse city. There are many chronic health conditions and diseases that are prevalent among residents in the community. Heart disease is the most prevalent in Milwaukee and is the leading cause of death in the city. Incidences of heart disease are higher among African Americans than any other race. Another large health issue that is a concern in the city. Obesity can contribute to many acute mental illness and overall lower quality of life. In 2016, it was estimated that approximately 37.2% of the population was obese, with a steady increase over the years. Further, rates of obesity are higher among lower socioeconomic status individuals. Overall, socioeconomic status is a factor that also contributes to health in Milwaukee. The median household income in the city is fairly low, being at $41,838, with 5.4% of individuals and families living in poverty. Education is also a contributing factor to this, with only 24.6% of the population above the age of 25 holding a bachelor's degree or higher. Segregation also contributes to poor health and outcomes city. The neighborhood segregation also contributes largely to the health disparities seen among racial groups, with 45.1% of the black population compared to 31.4% of the white population. Overall, there is a clear interconnectedness of poverty, segregation, and health issues in this city. The windshield survey and community assessment both highlight prevalent needs in the Milwaukee community related to health. Obesity is very prevalent in the city of Milwaukee and can lead to both acute and chronic health conditions and outcomes. Obesity contributes directly to the development of risk factors for cardiovascular disease and cardiovascular disease mortality. The correlation between obesity, heart disease, and health outcomes can be directly seen in Milwaukee, with heart disease being the leading cause of death amongst the population. This is even more prevalent among African Americans. Mental health disorders are another comorbidity that can be seen with obesity. Individuals who are obese have a 25% odds of having a mental health disorder. This results in individuals seeking care for cardiovascular disease, but mental health disorders as well in the city. There is an evident need for care in both health areas, with obesity being a large contributing factor to both health conditions. Other evidence that reflects the needs of the city of Milwaukee is the health related to segregation and race in the city. Fewer resources are accessible to neighborhoods north and south of the center of the city that are also struggling with poverty. These neighborhoods reflect extreme segregation and are home to minority groups of lower socioeconomic status. The table above outlines the incidence of obesity and mental health disorders among individuals of varying socioeconomic statuses. Community partnerships and resources are both valuable contributions and assets when it comes to facilitating community health changes and interventions. Both partnerships and resources have contributed to the enhancement of this community project. Primary partnership formed was with the Community Project Liaison, inpatient unit manager at the clinical site of Rogers Behavioral Hospital. This partnership was valuable in that it connected the project to the community site, provided assistance and feedback on project distribution, and contributed to the end of the community project and goals. The second partnership formed was with a doctor of osteopathic medicine at the clinical site. The partnership provided the project with clinical knowledge and expertise on health topics of obesity and mental health. This partnership also contributed to reviewing the resources created for the community project and provided expert critiques and suggestions on the project and its information. Two courses were utilized in the research and production of the community project. One valuable resource used was the clinical site for the project, Rogers Behavioral Health. Rogers is a mental and behavioral health hospital with inpatient and outpatient services for individuals. The facility also has a community resource center that is open to the public. The resource center offers materials that educate individuals on a wide array of health topics, as well as hospitality and spiritual care services. The resource center serves as a place individuals and families can go for information and assistance, making it an excellent clinical site for this project and an effective place to distribute resources to the community. The other contributed to this community project was the Aurora Health Care System Network and its online resources. Their online resources are available to the public and include information on weight loss and healthy eating recommendations from places like American Heart Association and the Academy of Nutrition and Dietetics. The resource was used to guide research and to outline information to be included on healthy nutrition and in this project. A nursing diagnosis that addresses the health issues seen in the city of Milwaukee is risk for obesity among individuals and families in the city of Milwaukee, related to lack of access to resources and knowledge deficits about proper nutrition and exercise in segregated and low socioeconomic status neighborhoods. This nursing diagnosis directly addresses individuals and families that have a lack of access to resources and who are of low socioeconomic status. It is important to target this population because obesity rates are higher among low socioeconomic status families, and those who have a lack of access to resources are coming from segregated neighborhoods in Milwaukee where rates of obesity are higher. As previously stated, cardiovascular disease is the leading cause of mortality in the city of Milwaukee, which directly correlates with obesity, a disease that can significantly impact the health of an individual's vascular system. This nursing diagnosis directly addresses these health and identifies areas for community health improvement. After assessing the Milwaukee in detail, a community diagnosis was formed. To address the community diagnosis, multiple interventions and resources will be implemented in the community with the aid of the Partnerships Forum resources utilized. The nursing diagnosis has multiple goals and objectives for individuals to achieve who utilize the provided interventions and resources. Each goal and objective is focused on improving and preventing the stated nursing diagnosis and current health status of the Milwaukee community. Goal number 1 is for the individuals at the Community Resource Center at Rogers Behavioral Hospital to be able to describe and identify healthy, nutritious dietary choices with appropriate food proportions after their first visit to the community center. Goal 2 is that the individuals at the Community Resource Center at Rogers Behavioral Hospital will participate in physical activity at least 30 minutes a day for 5 days a week within 1 month of visiting the community center. Goal 3 is for the individuals at the community at Rogers Behavioral Hospital to maintain a normal weight or trend toward a normal weight based on their height and age within 6 months of visiting the. To achieve the set goals for this project, interventions have been created and placed. First, an informative brochure was created that can be seen on this slide, outlining the negative impacts of obesity on mental health and overall health, outlining healthy nutrition and food proportions, as well as exercise and health goals, and the benefits of healthy diet and exercise. To accompany this resource, 5 recipe cards were created, each outlining a healthy recipe and listing its nutritional facts. These cards can be seen on the slide above. Both the brochure and recipe cards are intended for individuals visiting the community resource facility at Rogers Behavioral Health. These resources will be printed and physical copies handed out to visitors at the Resource Center during business hours to act as a daily reference guide for individuals to make healthier lifestyle choices and changes. Healthy nutrition and exercise are 2 important factors that influence obesity. By addressing these factors and making healthy changes, the rates of obesity could decrease, resulting in improved overall health. The evaluation of each goal of this project will vary depending on the goal and if it is short-term or long-term. To evaluate Goal 1, if identify healthy, nutritious dietary choices, these resources will be handed out by the creator of the project at the Resource Center. When handing them out, the creator will be able to interact with the individuals using the resources, ask them questions, and clarify individual understanding. It will be more difficult to evaluate the long-term goals of this project, which include Goals 2 and 3. To evaluate if individuals are participating in a healthy amount of physical activity, a survey could be implemented at the Resource Center to collect feedback from individuals to analyze if the resources are reaching the community. Data and statistics like this are also gathered at physicals and checkups, which are performed on every patient at Rogers Behavioral Hospital. This information could be shared with the Resource Center to evaluate the effectiveness of the resources and if it's reaching the community. To evaluate Goal 3, this could also be done by implementing a survey at the Resource Center to collect feedback from individuals who use the community resources. Data could also be collected and analyzed from patient physicals at Rogers Behavioral Health to analyze trends among patients to evaluate if this resource is an impact on the population. Through both partnerships and community resources, the unique health needs of the Milwaukee community can be reached and improved. This community project directly addresses the lack of access to resources and education related to nutrition and exercise. Project being conducted at a community resource center that is open to the public and reach individuals from the segregated communities seen in Milwaukee who have lack of access to resources and are of lower socioeconomic status. The implementation of this community project will aid in decreased rates of obesity, decreasing rates of chronic health conditions related to obesity, improving the mortality rate of the city of Milwaukee, and improving the mental health of the population.